Hello, my name is Michael Hara. I live currently in Boise, Idaho. I am in the psychiatric mental health nurse practitioner program, and I currently work on a telemetry floor in a substance abuse inpatient rehab facility. Um, my personal philosophy on healthcare is I believe everybody should have access to affordable and quality healthcare regardless of color, culture, spiritual beliefs, socioeconomic status, and geographic location. I believe everybody should also be treated fairly by the medical staff team, regardless of medical history, current diagnosis, and past decisions made in life pertaining to their health. I also believe it takes a whole medical team to improve the care of a patient, not only the nurse or the physician. Whether it is a nurse, physician, physical therapist, nursing assistant, unit clerk, case manager, housekeeper, and pretty much any other employee I may have forgot working in a healthcare setting. Everybody in a healthcare setting plays a vital role, I believe. As for my personal philosophy on nursing, I believe in treating the patient as a whole and not only the diagnosis. I believe working as a bedside nurse, we tend to only focus on the diagnosis sometimes. I had one instance when I was extremely busy working on a COVID unit, and I went into one of my rooms. The patient broke down, started crying. They were sad about their family being devastated by COVID, financial situations, and being isolated, in a COVID room for multiple days by themselves. At that moment, I had to be reminded it's important, to spend time with the patient, have an individualized care plan for each patient, build a trusting relationship with the patient, and take time to sit and talk with the patient so they can express their concerns. It is important to not just think of the patient as another number on the floor and remember these people are going through a difficult time and some have never been in a hospital before. I believe that it is extremely important to provide patient centered care for each patient. I also believe it is important to be the voice for each patient and advocate for them and provide education to each patient so they can make an informed decision regarding their health. It is also important we educate patients so they can maintain and improve their health. I also believe nurses should provide integrity, compassion, empathy when caring for each patient. Nurses should also avoid their own biases when caring for patients, never let their personal beliefs interfere with the care of their patients, and should avoid the stigmas pertaining to certain diagnoses. Lastly, I believe as nurses, we should continue to participate in research to improve healthcare and continue to stay up to date with our education and current technology trends. I also believe it is important to educate the community about various health conditions, not just each patient. This way, certain stigmas and myths pertaining to diagnosis can be reduced or avoided. As for someone like myself going into mental health, I feel it is important we continue to educate communities and families. As I continue my career in mental health, I hope to educate and promote mental health in my community, help people understand the importance mental health has on the body, mentally and physically, and also help reduce stigmas related to mental health. Thank you, and I look forward to seeing your guys' videos. Have a nice day.